Again, thank you for joining. My name is Dr. Doug Wingate. I'm an integrative neurorehabilitation specialist, as well as a licensed psilocybin facilitator in the state of Oregon. I've had the opportunity to facilitate for hundreds of individuals in legal psilocybin journeys, and have been working with individuals in my clinical practice, mostly with traumatic brain injury, post-stroke, neuro recovery, and complex neurological conditions for about the last 15 years or so. So today we're going to talk about psychedelic assisted neurorehabilitation. We don't need to worry about the big words metaplasticity here quite yet. We'll get into all of that. This is a talk where I'm going to try not to get too immersed in the weeds, but my postdoc was in clinical neuroscience. Brain science is kind of my thing. And I want to make sure that people get informed and have the information, have the resources. So there's a lot of slides with this one. It'll be recorded. You can request the slides. Just email me. My email will be at the end. Citations and resources are on the slides as well. So if this is something that you want to look more into, and I don't dedicate as much time as you'd like to a particular subject, you're welcome to dig into it on your own, or reach out afterward. But this one is kind of packed with information. I'm going to try to wrap it up within about an hour or so. But just to know, I'm going to try not to get too deep into things and make it accessible while also being informative and making sure that we really back this. This is a topic where we want to talk about the research, we want to talk about the science, and know that this is being explored and substantiated in the research capacity, as well as playing out in with the people that I have the opportunity to work with and facilitate for. So a little bit about where we're going to be headed and what we're going to be talking about. So very briefly, psychedelics have been shown to be able to increase neuroplasticity and metaplasticity. Again, we're going to talk more about what each one of those means. Very briefly, neuroplasticity basically means the nervous system or the brain's ability to create new neural connections and to be adaptable and create change, continue to grow, continue to create new neural connections. Metaplasticity, we'll get into, but it's basically different fluctuations in how plastic or how much plasticity there is in the nervous system and different things that influence that. So psychedelics have been shown to reopen what have been referred to as critical periods of development. We'll talk about what those are. This can include things like motor, sensory, and other types of critical periods. And it may be possible to leverage these critical periods or the reopening of these critical periods by pairing it with different rehabilitation strategies and approaches to create what's referred to as context-dependent relearning experiences. So these rehabilitation approaches build on basically this window of neuroplasticity that psychedelics allow and reopen for, and that this is context dependent. So the neuroplasticity is, in a sense, an opportunity to allow more information for your nervous system to be receptive to, and that what type of information you give the nervous system is going to be what it responds to, and is what is going to be supportive for the person, which is why we're going to have a discussion around why integration, especially when it comes to any sort of neurological concern or neurorehabilitation setup with psychedelics, that integration piece is really key in what you do following the experience itself, and opening that critical window is very, very important. And that this is translated or akin to acute periods of neurological responsiveness and repair. And we'll get into all of that. So, in terms of reopening critical windows, there's been a fair amount of discussion around psychedelics and their ability to reopen what are referred to as these critical windows of neuroplasticity. So, quote here, and again, I want to try to substantiate this material as much as possible. So there's going to be a fair number of quotes, and then we'll kind of maybe discuss what that means. So there are developmental critical periods with exquisite sensitivity to environmental input. Psychedelics may remove what's referred to as brakes on adult neuroplasticity, inducing a state similar to that of neurodevelopment. So what happens when we're really young and we're children is that we're information sponges, right? We're constantly learning, we're constantly taking in new information and creating and integrating that information and figuring out what to do with it. And we build out our perception of reality and and how to navigate reality and the world based on that information. And there are certain periods within our childhood or our development where there's more plasticity around different skill sets. So early in life, it's very body based, and the brain is creating a lot of neural connections around what the body does and elements of safety and survival and things like that around the age of 2 and 3 or so. There's egoic development, and there's also motor skill development and a realization of individuality. And then the sort of higher cognitive or executive functions tend to develop a little bit later, around the age of 7, 8, 9 or so. And then there's also a shift toward social development around adolescence and puberty. And so there are these different phases that the nervous system goes through where it's very receptive to a particular type of information. And these are critical windows of development that happen. And if we're not exposed to the right kind of or supportive information around that, then it can be prohibitive in terms of our development and slow that down. So, instances, there's been research done with infants who are not held and aren't exposed to touch, and their development is significantly delayed. Their awareness of their body is significantly delayed. Their immune system is very directly impacted by that. So all in all, there are these critical periods that happen during our development. And then as we reach adulthood, our nervous system sort of shifts to focusing on efficiency. And it's not taking in nearly as much information. The amount of neural connections that are happening and learning slows down pretty significantly. We've found that we're still able to create these new neural connections. Obviously, we can still learn new things. The more that we feed into that, the more that adaptability or that plasticity remains in terms of learning. But the nervous system on a whole shifts more toward efficiency and taking the information that it's absorbed during development and putting it to as much use as quickly as possible so that you can navigate the world more efficiently and more effectively. So, the discussion around this is that psychedelics might remove these brakes on neuroplasticity and kind of reopen that ability to become sponges again and take in a lot of information again. And then we're going to talk about what we can do with that. So we're going to reference Gol Dolan here a fair amount. He's a researcher doing some fantastic work around critical windows around neuroplasticity and psychedelics and what they do. And we'll talk about one of her projects around stroke as well in just a little bit. But quote from Gol here is that it might be that if what feels like to be it might be that if what it feels like to be in an altered state of consciousness, such as induced by psychedelics, um, or that mystical experiences that we think of with psychedelics is just what it feels like to reopen critical periods. And we'll see that there's a correlation between the psychedelic experience or the altered state itself and its duration and neuroplasticity. Uh, Here is a quote by Nardu. He's and several other researchers, including Goldolan. They've worked together talking about the ability to reopen the social reward learning critical period is a shared property across psychedelics. So they've done research with MDMA and other psychedelics, but the big research they're talking about here was with octopuses, and they gave octopuses MDMA, and then octopuses don't tend to be particularly social animals, but they found when they were given MDMA that they became quite social, and that there was a critical period following the MDMA administration where they sort of learned or adapted to more being more responsive to social reward and social interaction. So they found that the critical period is a shared property across psychedelics. They started with MDMA, then they tested other psychedelics. We'll see that in just a little bit. The reorganization of the extracellular matrix is a common downstream mechanism. So that's just saying it actually creates physiological change throughout the body in response to this. So this is some of this when they were taking a look at critical periods in different psychedelics. Here, he cropped off. That is, oh no, it didn't. Okay. So this is where they took a look at psilocybin here on the left. In the middle one, they took a look at LSD. So you can see the top dot here compared to saline. This is just showing that psilocybin, LSD, ketamine, ibogaine, and then certainly MDMA that they took a look at all seem to open up these critical windows of neuroplasticity where the nervous system was very receptive to new information. They also found that there's a direct correlation between the altered state of consciousness or the psychedelic experience and the duration, how long that lasts, and the duration of neuroplasticity that happens after you have a psychedelic experience or after you ingest the substance. So, for instance, ketamine is a pretty short psychedelic experience. It's not even a classical psychedelic. It's more dissociative, but it gets lumped into the psychedelic realm because it has psychedelic-like properties. But the ketamine experience is significantly shorter, can last anywhere from a half hour to 2 hours. Psilocybin, MDMA tends to be longer than that, anywhere from about 3 to 6 hours. There's definitely some metabolic individuality here where that can vary a fair amount. But generally speaking, LSD a little bit longer than that, 8 to 10 hours. And ibogaine is a really interesting substance that has a very long psychedelic experience. And we'll talk a little bit more about ibogaine in a little bit. But right now, just to see that it has a significantly longer psychedelic experience. And then the graph on the right is the duration that they found in terms of the open window of critical period and how long it was open. So with ketamine, the shorter trip, it was about 48 hours. With psilocybin, MDMA, in this study, it was 2 weeks. Other studies have shown that it's 3 to 4 weeks or up to about 30 days, where you have this critical window of neuroplasticity. LSD showed a little bit longer than that, and ibogaine was the longest in terms of a neuroplastic window. And so there's this correlation, or seems to be this correlation, between how long the psychedelic experience actually is and the immersiveness of that experience, and then how much neuroplasticity there is. And there are other ways to approach that. So, for instance, with microdosing, it's done rather than one big dose. Microdosing is done in repeated small subperceptual doses, and that repeated administration seems to also reopen a critical window of neuroplasticity. So on the social end of things, there's a discussion by a researcher named Robin Carhart Harris. He's a prolific researcher, fantastic work, and he talks about relaxed beliefs under psychedelics and what he refers to as the entropic brain theory. And basically, I'm not going to read this, but basically, the relaxed belief under psychedelics has a discussion around how psychedelics can allow for more malleability or openness to new ideas and new arenas of perception, and the ability to sort of alter the way that we take a look at reality in line with what might be more in line with our experience and less indoctrinated by early developmental patterns that we've kind of established. So psychedelics can, in essence, allow for more flexibility to take a look at and change our worldview based on new perspectives and the psychedelic experience on it by its own. So back to the critical periods and back to Gould-Dolan's work. She says we're beginning to see lots of circumstantial evidence that psychedelics are all doing the same thing in a sense, in a way that suggests that the social critical period, so that sociality, and the social part of it really is irrelevant, and that this is really tapping into molecular mechanisms, the underlying mechanisms that are conserved across all the different types of critical periods. And as I said, there are a number of different critical periods that come up during development. So motor periods, social periods, emotional periods, and somatic periods around body awareness, and that these all seem to have an underlying mechanisms, and that we can tap into that. And we'll see when it comes to neurotrauma, neurorehabilitation, those can all be impacted to some degree depending on what sort of trauma and how diffuse the effects are. So another quote here, really what psychedelics are this master key for unlocking critical periods. There are lots of different critical periods. We are beginning to get a sense that many of the critical periods close using the same sort of governing principle, the same kind of molecules, if not the exact same molecules, and will or have been implicated in the closure of, say, the visual critical period or the touch critical period or the motor critical period. So again, it's with the critical periods, there's this time frame where the nervous system is particularly receptive to a certain type of information. And beyond that, there's this closure after that. And when it closes, nervous system really can't take in that information. So going back to the body and the sensory information, if a child is not exposed to touch and doesn't get the sensory feedback early in life, even if they get a significant amount of touch and body feedback later in life, the development still tends to be uh, pretty significantly impacted. So it's like there's this closure of the window, and then it can still take in the information, but it's not nearly as impactful, and it's not going to allow or facilitate the same level of development as it would have if it happened when the body was really receptive to that and sort of primed or ready to create those connections. So metaplasticity, this term, meta means feeding back on itself. So metaplasticity is a plasticity of plasticity. And here we're going to talk about it in relation to what's called synaptic plasticity. That's our nervous system's ability to create synaptic connections. So the brain has the ability to do that, and metaplasticity is defined by a change in the ability to induce subsequent synaptic plasticity, such as long-term potentiation or depression. So metaplasticity is a higher order form of synaptic plasticity. What that means is that there are different things that influence how plastic the nervous system is. And when I teaching neurorehabilitation outside of the psychedelic realm, I talk about metaplasticity in terms of things like emotional states, time of day, what you've eaten or what you've ingested can impact the degree of plasticity that's going on or how receptive the nervous system is to information. So if you drink a bunch of caffeine before going in for a therapy session or a physical therapy session, your body's not going to be as receptive. It's going to be all hyped up. And the same sort of thing actually translates into the psychedelic realm, where caffeine can be prohibitive or really keep somebody in their mind, in their body, and it can um, lessen somebody's ability to really drop in and immerse themselves in the psychedelic experience. So I make the recommendation, don't drink caffeine before going on a psychedelic journey, or if you are a caffeine drinker, drink just enough not to get a headache or anything like that. But that it has this effect not only on state of mind, but also on a neurological level in terms of how it impacts your nervous system's receptivity to new information. So a little bit more from Goal here. Why does the brain have a sort of ready-made mechanism that psychedelics can tap into for reopening critical periods? And why can we reopen them so easily if the brain wasn't already built to do this? So just kind of reflecting that there seems to be a mechanism already built in, already tied in, and primed and ready to be responsive to these sort of psychedelic states or non-ordinary states of consciousness, because there are other ways of tapping into this. Breath work can be a really impactful, really profound way of tapping into altered states as well. There are a bunch of other ones, but obviously today we're going to focus on psychedelics. So she goes on to say, I suspect it's because when we have these habits, they're adaptive so long as the environment is stable. So we've taken in the information, we've formed a perception of reality and how to navigate that. And as long as the environment stays that way, like if we lived in the exact same situation over and over again, then it wouldn't be a problem. But then there's a radical shift. When there is a radical shift in the environment, then you can imagine that it would be adaptive to be able to reopen critical periods and to relearn from our environment. So that's what we're going to talk about. Neurotrauma, stroke, traumatic brain injury, things like that, is a radical shift in somebody's internal state and somebody's environment or the way that they have to navigate the world. So we're going to translate that over. Typically, the long arc trying to understand critical periods has really been focused around the idea that critical periods are great, but the fact that they close means that it's really, really hard to treat brain disorders in adults because the brain is no longer flexible and able to learn from its environment in the same way it was as a child. And we're going to look a little bit more about the critical periods as it relates to stroke and neurotrauma in just a couple slides. So if we want to understand the mechanisms, maybe we can figure out ways to reopen them for therapeutic benefit. And that's what we're going to talk about, psychedelics. Before we get into specifics of stroke and TBI, we're going to take a look at some recent studies that have come out, just kind of to touch on this or take a look at how psychedelics can be applied into neurorehabilitation. This is just a handy chart of how psilocybin promotes neuroplasticity. These underlying parts are metabolic processes that you don't really have to worry about, but essentially you consume psilocybin, the body breaks that down. Psilocybin is not psychoactive on its own, but as it breaks down into psilocin right here via the liver, so as your body digests it and starts to break it down, it converts it into psilocin. Psilocin is what is psychoactive. So that's why it takes a little bit of time before somebody feels mushrooms if they consume them. Why you've got 15 to 40 minutes or so, is because the body has to convert that into psilocin. Once it's converted into psilocin, it stimulates the serotonin receptors in the body, and that creates what we're going to talk about in terms of BDNF. That's brain-derived neurotrophic factor. This is a potent catalyst for change and for neuroplasticity. So very briefly, that's kind of where we're going to head in terms of how psilocybin and other psychedelics, other classic psychedelics that stimulate the serotonin receptors, stimulate this BDNF, and then it increases neurogenesis, neuroplasticity. Neurogenesis is the ability to generate new portions of neurons, and then plasticity is the ability to make those connections. So some recent research that's come out around some of this. This was a study that showed that psychedelic mushrooms, psilocybin, can regrow brain tissue that can be lost following depression. It's well established that with depression, it can impact the actual structure of the brain, and they've been able to demonstrate that psilocybin induces rapid and persistent growth in dendritic spines in the frontal cortex. So when working with depression, whether or not it's been shown that depression can particularly, in fact, impact the frontal lobe, the area of the brain toward the front of the head there. And so when they're doing interventions like TMS, transcranial magnetic stimulation, for depression, it's usually located over the left frontal lobe, left dorsolateral prefrontal cortex in particular. So they did the study and found that psilocybin was able to regrow the brain tissue that had been lost in depression. This was a mouse study. They did another study, or another study has been done taking a look at the very potent psychedelic DMT, and it's shown that it can reduce stroke damage. And so the quote here, or the title is that DMT, or dimethyltryptamine, mitigates experimental stroke by stabilizing the blood-brain barrier and reducing neuroinflammation. We're going to talk about neuroinflammation a fair amount in just a little bit. Psilocybin was found to be able to reverse the effects of brain injury resulting from domestic violence in a rat study. So they found psilocybin mitigates chronic behavioral and neurobiological alterations in a rat model of recurrent intimate partner violence related to brain injury. This was a kind of a rough one for me to read in terms of how they conducted the study and emulated domestic violence, but they did the research and found that psilocybin was able to reverse the effects of the brain injury caused by the study. And then I'm based in Portland, Oregon, and this is some research that's been done out of the legal framework of psilocybin. So since Oregon has legalized psilocybin, we've within the state there have been over 15,000 individuals that have safely had legal psilocybin journeys within service centers. I operate one of those service centers. And this has allowed for some research to come out of that. Some of that research is taking a look at traumatic brain injuries and finding that psilocybin was able to reverse traumatic brain injury effects. They took brain scans, and the tests showed the cognitive varying degrees of cognitive improvements in MMA fighters after treatment. So MMA fighters who had sustained multiple brain injuries, multiple concussions, their brain scans prior to and following a psilocybin journey showed significant improvement. So they're seeing a lessening of the asymmetry of the prefrontal cortex in this particular person's case. This is a really recent study that took a look at how psilocybin triggers activity in large-scale cortical networks. So they're taking a look at different brain networks, different areas of the brain that communicate with each other. And they found that it facilitated change and allowed for change within these networks. But the last dot here, they took a look at what happens if you alter that or introduce uh, different strategies and different ways to sort of manipulate or support the neuroplasticity. And then, so the quote is, our study hints at an exciting avenue for future research to combine neuromodulation with psychedelics. Neuromodulation is any sort of approach that addresses or supports or facilitates change in the nervous system. So a lot of the interventions that I'll mention toward the end of this are different types of neuromodulation that can be integrated in as part of the integration process following a psychedelic experience to help with neurorehabilitation. Combining neuromodulation with psychedelics to precisely target specific circuits for neuroplasticity. So you can really sort of steer how the nervous system is reacting or how it's working with the neuroplasticity that's come out of the psychedelic experience. So move on to stroke. This is some work that's being done by Dolan in the Dolan lab, along with John Hopkins, taking a look at psychedelics and their impact or potential help with stroke. The study is called Phantom, Psychedelic Healing Adjunct Therapy Harnessing Open Malleability. And it takes a look at context-dependent critical periods. So again, we have the critical periods, a window of time where there's neuroplasticity, and how context-dependent it is. So the hypothesis here is that combining psychedelics with physical therapy in digitally enriched environments will restore the ability to recover motor function in stroke patients, even in cases where the stroke happened months to years prior. And this is really significant because what happens after somebody has a stroke or a neurotrauma is that there's a period where the brain and the nervous system is trying to actively heal and is very adaptive. And so this is another kind of critical window that happens after neurotrauma. You have a period of time where the body is making a lot of new neural connections and trying to heal and adapt because it needs to in order to survive and in order to function. And it's generally considered that this window is anywhere from 3, 4, 6 months or so. And what this graph is showing at the bottom here is the green line is amount of neuroplasticity, basically. And so we have this up spike very quickly after a stroke happens. The nervous system is very adaptable and doing what it needs to do. This begins to wane somewhere between 7 days to 3 months or so. By 3 to 6 months, it's been significantly decreased, and then beyond 6 months, generally considered if you have a stroke, you want to basically get in as quickly as possible and do as much as you can within the first 6 months, because following that, the responsiveness of your body is way less. And so it can be a lot more difficult to work with somebody and see progress. Definitely not at the same rate that you would if they came in less than 6 months. So in my clinical practice, I sometimes see people who come in years following their stroke, and we have the conversation of, we can see progress, but it's going to be a lot slower. And this sort of critical window has closed. You're beyond the acute phase. And so some of the promise here that the Fathom research is taking a look at is that we might be able to, with psychedelics, reopen another period of time, again, with things like your classical psychedelics, psilocybin, LSD, and even MDMA, that this could be 3 to 4 weeks or up to about 30 days or so, where we have another critical period where the body is very responsive. So if you want to get in there within 6 weeks to 2 months or so, where physical therapy is going to have its maximal effect, this is following administration of a psychedelic. So where it's going to have its maximal effect or benefit for helping you to recover the motor function that you lost because of the stroke. So again, a lot of the conversation around psychedelics and taking a look at mental health is that it's very responsive, but we're able to translate this into everything, including motor function, that can be significantly impacted after stroke. So that window closes just like all of the other critical periods close. That's that 30-day-ish or so. While an interdirected trip with a lot of psychotherapy makes a lot of sense for things like PTSD and addiction and depression, which is where a lot of the research on psychedelics has been, it's probably the wrong context for a stroke. So psychotherapy following a stroke or following a psychedelic experience aimed at neurorehabilitation probably isn't going to do a whole lot. Whereas doing a lot of physical therapy and movement, and they're using virtual reality motion games, which can be really helpful in neurorehabilitation, might be the right context for giving the psychedelic for stroke. So, in recent years, psychedelics like psilocybin, LSD, and ketamine have garnered considerable interest for their potential applications in neuropsychiatric treatment and neurorehabilitation. While traditionally explored for their antidepressant effects, these compounds have demonstrated notable abilities to enhance neuroplasticity and influence metaplasticity mechanisms, which could be particularly relevant for stroke recovery. And this is from another study, Harnessing Psychedelics for Stroke Recovery, Therapeutic Potential for Mechanisms, in the journal Brain. Um, and then this information can also be directly translated over to brain injury and neurotrauma. I use here the term acquired brain injury. It's just a wider scope than traumatic brain injury. So it includes other types of brain injury that can happen beyond just overt trauma, overt physical trauma. So this can include stroke. It also includes things like hypoxia if for whatever reason somebody has brain injury because they're not getting enough oxygen or not enough blood flow to the brain. I've worked with individuals who have drowned, and these are acquired brain injuries in addition to just things like falling or hitting your head. Not to discredit the impact of those for sure, but just to say that ABI is a broader term for brain injury or brain trauma as a whole. So ABI can cause both focal and diffuse injury to neurons, glial cells, and neurovasculature. They can result in delayed symptoms that are notoriously difficult to treat. Brain trauma can have very persistent symptoms, even if it's considered a mild brain trauma. Mild is a gauge of how significant things were at the time of injury and really doesn't have anything to do with the severity of the symptoms that persist afterward. And these can be life-changing events where people have symptoms for the rest of their life or for many years afterward. And as it says here, can be notoriously difficult to treat. That's, like I said, been my clinical focus for the last 15 years in working with integrative neurorehab is most of the people that I see have some sort of history of concussion or head trauma or brain injury. So, while research investigating the efficacy of psychedelics in the treatment of ABI is limited, their neurochemical and psychological effects offer promising prospects. These mechanisms may contribute to cognitive and behavioral improvements in ABI. And I'm not going to go over all of the particulars of these, but when taking a look at psychedelics having neuroprotective and neuroregenerative effects. Psychedelics do show promise. They're neuroprotective and enhance neuroplasticity, including neurogenesis and neuro outgrowth. Therefore, administering psychedelics during the acute phase of ABI could potentially mitigate subsequent complications, while their use during the chronic phase might help alleviate persistent ABI symptoms. So psychedelics do seem to have a neuroprotective effect and this neuroregenerative effect of increasing neuroplasticity, both of which may be very helpful following some sort of brain injury. Excitotoxicity, mitochondrial dysfunction, and oxidative stress can all be issues after having a brain injury. Excitotoxicity is where neurons are so excited that it leads to cell death. So you're having the cells or brain tissue actually dying because there's so much going on. This leads to dysregulation overall, overloads the mitochondria. Mitochondria are the powerhouse of the cell, of course. So what creates the energy within our body to be able to do anything that includes the healing process? So you overload the mitochondria, and then all of a sudden we don't have enough ATP. We don't have enough energy in the body. ATP is the energy currency that our body uses. We have excessive ROS, that's reactive oxygen species. So that's antioxidants are very helpful in reducing um, ROS. So we have an energy crisis in the body essentially, and that leads to more cellular damage. So the body doesn't have enough energy. It's not creating enough to do what the body needs to in order to heal at the same time that we're having cell death and tissue damage. So there's research taking a look at the protective effects of psychedelics against this excitotoxicity. It can buffer against stress. Mushrooms as a whole are antioxidants, so it helps address some of that ROS issue. And there's evidence that serotonin 2A agonists in particular, that's 5-HT2A right there, 5-HT just means serotonin, that's such as psilocybin also have antioxidant effects. So of course, psilocybin itself is a mushroom tending to have antioxidant effects, but other serotonin 2A agonists also seem to have antioxidant effects. So kind of a two-in-one there as far as the psilocybin goes. With brain injury, apoptosis can be a problem. Apoptosis is programmed cell death. So again, we have this turnover where cells are dying, tissue are dying. It's necessary. Apoptosis is necessary following injury in order to keep a balance of healthy cells. So if there's direct trauma, we need to kill off the unhealthy cells so that the body has the capacity or so that the body regenerates. It's just part of the natural process following trauma. Damaged cells die off. And also, apoptosis helps prevent tumors, make sure that cells don't overly proliferate and become problematic. They live out their life and then don't continue to do so, don't continue to grow beyond their means. But after a brain injury, there can be a chronic elevation in apoptosis. So you have too much cell death going on for too long. And that there is a potential link between brain injury apoptosis, so this increased cell death, and progressive neurodegenerative diseases. We'll take a look at neurodegenerative diseases in just a little bit, but there is this tie-in. A direct tie-in would be a case of CTE, chronic traumatic encephalopathy, where having multiple concussions or sustaining multiple brain injuries leads to this progressive condition where there's just um, things continue to get worse and worse. It becomes neurodegenerative, and the body and the brain sort of continues to break down. So I'm not going to go over all of this, but psychedelics has been shown to decrease apoptosis and elevate BDNF. If you recall from earlier, BDNF is the brain-derived neurotrophic factor. Um, and this leads to activation of what's called TRKB or TrkB. And both BDNF and TrkB, basically what you need to know here is that those things are very, very important when it comes to creating the neuroplasticity. So the psychedelics help increase the neuroplasticity through these mechanisms. It is interesting to note that psilocin and LSD directly bind to TrkB, displaying affinities 1,000 times greater than antidepressants. So, a lot of the discussion around antidepressants more recently is that it also increases neuroplasticity to a degree. And that may actually have some of the antidepressant effects. More so than the actual serotonin dependent, but that's a whole conversation that's happening. So what they found was psilocin and LSD displayed affinities 1,000 times greater for to this track B than antidepressants and ketamine. And then just that track B has also been tied into decreasing what are called neurofibrillary tangles and amyloid beta plaques. These are things that are found in Alzheimer's and neurodegeneration. So just to know that there's a tie-in again with these neurodegenerative disorders and how psychedelics may impact that through this track B mechanism. We already talked about neuroplasticity. So what they found is that dose dependence has a lot to do with neuroplasticity. Lower doses with psilocybin increased newly generated neurons, while higher doses had the opposite effect. Higher doses allow for global communication throughout the brain. It creates um, what's referred to as a decoupling between areas of the brain that normally communicate and then opens up to a more global communication. So that's why it can allow or act as a catalyst for significant change through the brain as new areas of the brain are talking to one another. But when it comes down to strictly neuroplasticity, repeated lower doses has actually been shown to have a higher impact on neuroplasticity itself. It doesn't really allow for that catalyst of being a significant change to longstanding patterns, but it's reinforcing in terms of helping the nervous system create those neural connections. And then neuroinflammation, brain injury triggers neuroinflammation. That's inflammation in the nervous system and within the brain, very quickly within minutes and hours. Acutely, right after an injury, this is neuroprotective. So the brain uh, the nervous system becomes inflamed in order to clear out um, any of the damaged cells and make sure that the nervous system is protected. But if it becomes chronic or excessive, if it goes on for too long or there's too much inflammation, it becomes problematic. Too much inflammation, it starts to impair brain function, and it contributes to secondary injury, to, actually cause injury to more tissue in the surrounding areas. And if it continues even longer, then you can have lasting physical, cognitive, behavioral, and social impairment. So right after an injury, neuroinflammation is helpful. If it continues, it's problematic and it causes all kinds of issues. So psilocybin decreases pro-inflammatory cytokines, so it reduces the things that cause the neuroinflammation. Psilocybin or psilocin and DMT have been shown to modulate immune response markers. Psilocybin was taking a look at being administered both alone and in combination with eugenol, and they showed that if you combine them, you actually had a greater neuroinflammatory reduction. So that showed that pairing psilocybin with other things that help reduce neuroinflammation actually can have a synergistic effect, work together to reduce the inflammation even more. So the ability of psychedelics to mitigate neuroinflammation carries significant implications for the management of ABI or brain injury. And then psychedelics have been also shown to have a network-wide brain changes. So being able to create change throughout the brain, throughout different networks of the brain. So again, won't go through each one of these, but essentially they've been shown to help increase functional connectivity, what here is referred to as FC, where we have more communication throughout the brain and increasing the connections that are there and how functional those are. Increasing or amplifying crosstalk between different areas of the brain as well, and that it might be facilitated by decreasing what's referred to as thalamic gating. So the thalamus is an area of the brain that takes in sensory information from your whole body and from the inside of your body. It's sort of works as a relay hub for incoming information before it gets passed on to most of the rest of the brain for processing. And thalamic gating refers to it sort of having a say of what information passes on to the brain and what gets processed. And this is decreased during the psychedelic experience, which may be part of the mechanism of why things become much more vibrant or the sensory experience is heightened, is because there's less gating happening. The body is, there's psychedelics have sometimes been referred to as non-specific amplifiers of information. I tend to refer to them as more non-specific disinhibitors because our brain is doing so much through the thalamus to inhibit the amount of information that's coming in, or only allow so much information that we're able to process it and make sense of it, so that it's not overwhelming. And disinhibition um, is breaking that pattern or softening that inhibition that's happening so that the sensory information that we are often filtering out is now coming in and we experience it as being amplified because it's not being inhibited as much. So that's part of what psychedelics also do. They work with the default mode network, an area of the brain that has a lot to do with our sense of ego, our sense of self, and how we navigate the world. And following a traumatic brain injury or ischemia, there can be alterations in the default mode network and the functional connectivity in there. And this can be associated with affective and cognitive function dysfunction. So psychedelics, psilocybin, and serotonergic psychedelics have a direct relationship or impact on this default no mode network that can be impacted after brain injury. Um, Traumatic brain injury induced damage to white matter tracts of the salience network, another network within the brain that sort of transitions between, it's referred to as the default mode network, and the uh, um, a frontal executive network. There's this dynamic between those. The salience network has it's kind of the go between in shifting attention there. And psychedelics have also been shown to impact and modulate the salience network as well. So a couple studies that have directly taken a look at how psychedelics can impact after brain injury. With psilocybin, there was a study that took a look at psilocybin as a treatment for repetitive head injury, and the conclusion was they provided unprecedented data that psilocybin can reduce vasogenic edema, restore normal vascular reactivity and functional connectivity, reduce phosphorylated tau buildup. Again, tau has a lot to do with plaques that build up and are associated with neurodegeneration and Alzheimer's and dementia type symptoms. It was also found to enhance levels of brain-derived neurotrophic factor, which again has much to do with neuroplasticity, and its receptor, that track B that we mentioned earlier, and modulate lipid signaling molecules. So those are all the mechanisms that they found. Basically, it helped restore blood flow, move out fluids, and increase functional connectivity following a brain injury. Another study, the potential role of psilocybin in traumatic brain injury recovery, said that assisted psilocybin use may have benefits in TBI by reducing inflammation, promoting neuroplasticity and neuroregeneration, and alleviating associated mood disorders. And then says that it makes sense to do more studies because the findings were so positive here. There's a study that's gotten a fair amount of attention with ibogaine, taking a look at military veterans. Sorry, that was my dog in the background. Military veterans who had sustained a traumatic brain injury, they were given ibogaine plus magnesium that led to dramatic clinical improvements and a favorable safety profile, saying that further studies with state-of-the-art safety monitoring will be crucial to unlocking potential benefits of this psychedelic compound. This warrants a little bit of discussion as far as I'm concerned with ibogaine. Ibogaine, like we talked about, is a very potent psychedelic where the journey can last 36 to 72 hours or so. It's usually outside of cultural context where it's been used traditionally for generations and centuries. It's usually administered in a setting where somebody is closely monitored, like in a hospital setting for there's really interesting research around ibogaine for addiction and in particular opiate addiction and having really fantastic results around that. But people do need to be closely monitored because it does have cardiotoxic effects and it can lead to heart issues um, during the journey itself. The experience is so intense and so impactful on the body that you want to have somebody monitored, like having a heart monitor going and monitoring their breathing during the experience to make sure basically that they don't have a heart attack. So there's some safety risks with ibogaine that I really want to emphasize. So it's not a casual thing that you just step into. And with that, I've included this recent post by Justin Lepre, who talks about ibogaine not being an entry point when it comes to psychedelics. So I'll just read it. And to be clear, this is not a rejection of ibogaine. They serve it in their sanctuary in Texas, so they work with ibogaine. But he wanted to make a very clear point that ibogaine is not something that you just jump into. With one important distinction, individuals struggling with addiction, ibogaine can be an appropriate first medicine when held in a medically informed, ceremonial, and integrative container. So, with people being very closely monitored to make sure that there are no issues that go on. Outside of addiction substance use disorder, I do not believe ibogaine should be an entry point into entheogenic ceremony. Ibogaine is one of the most powerful medicines on the planet. It demands reverence, preparation, comprehensive medical screening, psychological readiness, and long-term integration. Offering it as a first experience for individuals not working with addiction does a disservice to both the person and the medicine. For things like post-traumatic stress, traumatic brain injury, anxiety, depression, ideation, and personal growth, there are safer and more appropriate starting points. It continues on to talk about MDMA and psilocybin in particular, but I do want to make that point because the conversation around, and I do get asked a lot about ibogaine in this study in particular with military veterans, does seem to lend some prominence. They're taking a look at how magnesium might allow for it to be safer, relatively safer, but it's important to be aware of the risks when it comes to ibogaine and the conversation that happens around that. Um, There's still a lot of research to be done when it comes to taking a look at the particulars and the effectiveness profile when it comes to brain injury and psychedelics. Because psychedelic experiences can be overwhelming and emotionally intense, it's widely recognized that preparation and integration are essential safety and support components, making sure that somebody is really in a place is, or finding out if somebody is in a place to go into an altered state of consciousness and navigate some of those intense experiences. So if somebody is not, for whatever reason, if somebody is coming to me and looking at potentially doing some psilocybin work, we may do some microdosing before, or we may just have to stick to microdosing because they're not really in a place for the intensity of the experience that can come with psychedelics. And so when it comes to severity of brain injury, their ability to consent to that type of experience can also become an ethical conversation as well. So there's a number of different factors that come into play when it comes to working with neurorehabilitation, in particular brain injury or stroke and psychedelics, and that's important to keep in mind. Briefly on chronic pain, they've taken a look at psychedelics in relation to chronic pain. They did cross-sectional survey of adults that had used psychedelics to self-treat chronic pain, and they found that most reported either completely stopping or significantly decreasing use of one or more non-psychedelic substances. This is things like their pain medications. 21.2% indicated that the decrease in use persisted for more than 26 weeks after the psychedelic use, so they were able to step off of those medications for an extended period of time. Alcohol and prescription opioids had the highest proportions of what people were able to decrease or get off of, which is fantastic when it comes to chronic pain, especially with the opioid epidemic and overuse of opioids. And if somebody is able to step off of those and not require those, it's considered fantastic as far as I'm concerned. So perceptions of health outcomes following psychedelic use were broadly positive, and psilocybin was reported to be the most effective substance for both physical and mental health symptoms in this survey. Neurodegenerative disorders, things like Alzheimer's, dementia, and we mentioned CTE earlier. Psychedelics stimulate neurogenesis and gliogenesis, reduce inflammation, and ameliorate oxidative stress. Therefore, they're promising candidates for future therapeutics for psychiatric neurodegenerative and movement disorders. Importantly, psychedelics hold the promise of being disease-modifying therapeutics and not simply just providing sympathetic relief. Research study is right down there that the quote is from. So working on the underlying mechanisms, and again, as it says, they're not just working on the particular symptoms, but really the processes that are underlying that and happening in the background. So this is just a diagram demonstrating that. The references down here, over here on the bottom right, you can see we have neuroprotection, neurogenesis, neuroplasticity, slower disease progression, and then clearing out neuroinflammation as well, under the treatment side of how psychedelics help impact this or may impact this. So their broad therapeutic potential might result from an ability to rescue cortical atrophy, common to many neuropsychiatric and neurodegenerative diseases, by impacting neurotrophic factor gene expression, activating neuronal growth, survival mechanisms, and modulating the immune system. So just some more as far as mechanisms where psychedelics may be helpful in neurodegenerative disorders. This is early in research. I've got some research studies coming up in the next couple slides, but they are taking a look at this and seeing positive results thus far, allowing for some really interesting discussions on how psychedelics may help the nervous system in preventing or working with uh, situations where neurodegeneration is in play. So the primary target of serotonergic psychedelics, like psilocybin, LSD, the serotonin 2A receptor plays key roles in cortical neuron health and is dysregulated in Alzheimer's disease. Moreover, evidence suggests that psychedelics and related compounds could prove useful for treating the behavioral and psychological symptoms of dementia. So this was in a study, Psychedelic-Inspired Approaches for Treating Neurodegenerative Disorders. Really interesting article, goes a lot more into detail if that's something that you're interested in. So a really interesting case report where they gave somebody with multiple sclerosis. And multiple sclerosis is known, you can see in the imaging here, you have degeneration of white matter in the brain. So you'll have these areas or sort of holes in the brain where the white matter is broken down. And in this case study, they gave somebody with MS, multiple sclerosis, ibogaine, and found following that the cortical and subcortical changes observed may represent adaptive processes contributing to clinical improvements. Modulation of the neurocircuitry related to pain and motor function may underline these effects. So there was significant lesion reduction and neural structural changes following the administration of ibogaine. So again, caution around ibogaine. This is just a case report, so it's a very significant finding if there's reduction in MS lesions, but very, very preliminary. So it would be really interesting to see if there's more research that gets started around this or gets funded around this. But some other studies that have come out recently, they took a look at Parkinson's patients, 12 Parkinson's patients who were given psilocybin, and the results showed that there were, one, no serious adverse effects, and no symptoms of psychosis were worsened. So great there. But the people with Parkinson's also experienced significant improvements in motor and non-motor functions for up to a month, and their anxiety, depression symptoms improved as early as a week after the psilocybin. And then taking a look at Alzheimer's and DMT in relation to Alzheimer's, the natural occurring hallucinogenic DMT is a SIG1R agonist, as well as being a serotonin 2A agonist. Its SIG1R agonist properties give it protective effects against hypoxia, so the not getting enough oxygen, so it's increasing the availability of oxygen, um, as well as cerebral ischemia, which is the result of damage to the brain caused by a lack of blood flow. In the recent study on mice, DMT was shown to improve the effects of Alzheimer's disease thanks to the SIG1R activation of the molecule. So it'll be interesting, again, to see what kind of research comes out of that as they do more around that. While more research is needed to probe the effects of psychedelics in models of neurodegenerative diseases, the robust effects of these compounds on structural and functional neuroplasticity and inflammation clearly warrant further investigation. So, very interesting research that's being done with neurodegenerative disorders, but still very much in its infancy. Before I wrap up, it's a lot of the research that's out there, a lot of the general conversation, and how psychedelics can help build a platform or a foundation for neurorehabilitation and allowing for that to potentially be very much more effective. Brought in and talked about integration as being really, really important around this. And this is something I've developed, I refer to as the ecology of integration, where different modalities, different approaches can be brought in, and that there's an interrelationship, or all of these play into one another as you're bringing things in. So it can be very helpful to sort of what's referred to as stack these therapies or use more than one simultaneously that are going to be supportive to the nervous system, to the brain in different ways. So there are movement-based therapies like physical therapy, occupational therapy, things like Qigong, yoga, Fettel approaches, psychotherapy as a means of working through the material that may come up, or working through the emotions that come up from a journey, or by working through, or working through the impacts of the trauma itself, if it's a neurotrauma type situation. Speech and cognitive therapies, things like speech therapy, cognitive processing therapy, mindfulness-based cognitive therapies, and what's referred to as applied metacognition or metaprogramming, taking a look at the way that we look at the world and reflecting on that and actively working on changing some of that. Somatic therapies, things like body work, massage, breath work, somatic experiencing, body-oriented psychotherapy, all of those things work to help support the body and get that feedback to the nervous system in the brain. So it can be supportive in a different way. Pattern sensory input, things like neurofeedback, neurobiomodulation, which is something I use very frequently in my practice. Photobiomodulation is the use of cold lasers to stimulate the body or the brain in different ways, acupuncture, binaural beats, and audio-visual entrainment, virtual reality, vagus nerve stimulation all fall into this. And then working foundationally on the biological foundations that provide the what's needed for the body in order to heal. So things like supplements, diet, hyperbaric oxygen therapy is another one that I work with very closely that can be foundationally supportive for increasing the oxygen that's available to the body, and it also supports mitochondrial function, which allows for the production of ATP, so your body physically has the energy to do what it needs to do to heal. Molecular hydrogen can be very supportive with this as well, and metabolic support. So when you're taking a look at integration, and when I am figuring out what's going to be most supportive for somebody, I take all of these into account and determine or have a discussion around which might be most supportive for somebody's particular situation, because no neurotrauma is the same. They're all different. They all can stem from very similar patterns, but it shows up differently for each different person. And so figuring out what's going to be the most supportive and how they may work together and giving consideration to that, and not just focusing necessarily on one approach, but multiple approaches in an evolving ecology of what their integration process takes a look at, or what their integration process looks like. Okay, so in review, circle back a little bit. Psychedelics have been demonstrated to increase neuroplasticity. Psychedelics have been shown to reopen critical windows of development where the body and the brain is going to be more receptive to any of the other interventions, any other forms of neurorehabilitation that somebody might be utilizing. That can include motor, sensory, and other types of critical periods that allow um, or other types of critical periods, such as those following a neurological trauma, such as stroke or brain injury. And we might be able to leverage the critical period reopening with psychedelics paired with adjunctive interventions, any of the ones that we mentioned through here, or any others that might be relevant for somebody. For instance, I don't think vision therapy is on there, but vision therapy is a very common one following brain injury. Somebody may be more receptive, or their nervous system may be more receptive or more adaptive to vision therapy in that case. That psychedelics allow for this greater receptivity of the interventions, and that it can bring on a context-dependent relearning experience akin to the acute periods of neurological responsiveness or repair that typically happens right after an injury. And then I want to end with some final thoughts around PTSD and traumatic brain injury, because there has been a lot of research with psychedelics and its relationship to trauma, emotional trauma, and PTSD. And there are also many, many similarities between PTSD and traumatic brain injury if you take a look at the neurology of it and the neurobiology of the impact that PTSD has on the brain itself and on the nervous system. Here on the left uh, of the diagram on the right, it lists with the black arrows the areas of the brain that tend. Sorry, yeah, making some noise there. The black arrows are the areas of the brain that tend to be affected by PTSD. The red arrows are areas of the brain that tend to be affected by traumatic brain injury. We have the prefrontal cortex in both. We have the hippocampus, the memory center of the brain, in both. And we have the amygdala, primary emotional center, impacted by both. The hypothalamus has a lot to do with hormones, is impacted in PTSD. Hormonal dysregulation is very common after a brain injury. Hypopituitarism is very common after a brain injury, so there is some overlap there. And the ACC, the anterior cingulate, impacts attention. And it can be impacted with TBI. This can also be impacted by PTSD. So it's not listed as a primary area, but many areas of overlap. There's overlap in symptoms as well. PTSD here and PPCS is persistent post-concussion syndrome, so brain trauma. And you can see many of the symptoms here in the middle overlap. And individuals with PTSD do experience headaches and sensitivity to light at times. And their vestibular system can be impacted, so they can experience dizziness, whereas post-concussion syndrome, there can be a significant emotional component, and often these things are in coexistence anyway. So with the research that's been done around psychedelics and PTSD, just because there has been so much more research done with that, we can take a look at some of those underlying mechanisms in the conversations that's been done with PTSD and kind of look at that and how it might translate over into situations of brain injury and neurotrauma. So I want to leave you with that. And then if you have any questions, if you want the slides, this is recorded, so I'm going to upload it and you'll have access to it. I'll send out an email to everybody who's signed up. But if you have questions, you can email me, or if you have some right now, I'm going to get out of this. And I thank you for your time.